residents are anxious to get vaccinated. And I think the word anxious is an understatement. So much so that people are registering on the PrepMod website. They are registering on every website for each hospital system, healthcare system here in the state, and they're also registering for every pharmacy that they find. And whenever someone receives a pre-registration notification, I've seen firsthand that those emails are shared on social media, neighborhood listservs, and group texts, and any other forms of communication. And we know that when people share those links, it results in a few problems down the road, that people show up to sites and they are deemed ineligible, but they had registered anyway. And then also we know that there's further confusion because people are occupying multiple sites so that they're getting confirmation at multiple places. And all of this has created a free-for-all where Marylanders are competing against each other, and some have even compared it to the Hunger Games. And compounding this fact is that the state continues to expand eligibility now in Tier 1C, while Montgomery County's health department is still in Tiers 1A and 1B, for which we don't even have enough vaccines to fully cover everybody in those classifications. So my question, and the question that I probably receive more often than any other, is why isn't the state taking a more centralized approach to registration, a one-stop shop where people can enter all of their information and then be assigned to one of the vaccine providers in their area?
So, Dr. Chan, I'm happy to take this question, and thank you for that. I think first and foremost, we recognize that there's frustration getting an appointment because of our limited supply of vaccine. But I do want to highlight that what we're doing is working. We're getting people vaccinated. We've gone from 2,000 a day to on average over 22,000 a day. And to your point that some folks are signing up for multiple appointments, we haven't gotten any reports of that. What we are hearing is that people are signing up for multiple wait lists, and that's their they have the option to do that, and if they want to, then that's they have the ability to do that. We do ask that people remove themselves from the wait list after they do get an appointment to kind of free those spaces up, but we have not heard of people getting multiple appointments. And then just to the centralized system, there are only 4 states in the country that have gone towards a centralized system. And so I think this notion that Maryland is different and that we should be moving towards that system is kind of misinformed, because not many other states are doing that. We looked into that approach, and our healthcare system is not set up for a centralized system. The 4 states that have done it are Oklahoma, New Hampshire, New Mexico, and West Virginia. And that's just not a good analog to compare to Maryland, because our populations are so drastically different. And we also learned through the testing process that providers prefer to use their own systems. It allows for agility in scheduling changes to be handled directly by the providers. And I think the biggest thing is there's no single point of failure. When we have several options for folks to sign up, it moves away from a bottleneck or one large system failure from occurring.
Thank you.